Welcome, guys. Welcome. Welcome to my channel. Excuse me. The sneeze coming on. Yeah. Got a little bit of a voice there. As long as I don't push it. Welcome to my channel. Today, I'm going to show you my post-op visit. And that you see how I'm progressing along. Today is the first day talking after 10 days. So I would not be doing very little. All right. So thank you to everyone that has been there for me, been praying for me. My heart is overwhelmed, and I'm not gonna tear up. I just want to say thank you. Let me show you the videos of my post-op visit today, and you'll be able to understand my next move and what's going on. So let's get a video.
Yep.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9.
Good. Then let me hear. Eee. Feels a little wobbly, huh? Yeah. Okay. Can I take a look at the camera? Through the nose?
Yes.
Yeah. Okay. All right.
I'm supposed to go to work tomorrow. Can I?
You are?
I'm scheduled to. It depends on what you.
You can go.
I have to talk at work.
How much talking? Remind me what you do for work?
I'm a dialysis technician.
That's right. That's right.
And
What I say is you are just under 2 weeks. So I usually like to do like 2 weeks of light voice.
Okay.
Meaning like not using the voice for more than like 30 minutes of the hour.
Okay.
You know, so when you don't need to be talking.
Don't talk.
Like in between patients, you just kind of
Okay.
rest. And then like try not to whisper,
Yeah,
yell, or
whisper.
sing.
Okay.
Just like use your normal volume voice.
Okay.
Okay. I'm gonna take a look. You spray up the
All right.
nose.
All
You
right.
remember this yucky stuff,
I
right?
do.
Okay. All right. Here comes the spray, nasal spray. And then, you know what I think might be good for you is a little bit of voice therapy,
Yes.
which is kind of like physical therapy, just like if
Yep.
you had knee surgery, you do some voice therapy. I could have someone see you today.
Okay.
Do you have time to do a first
Yeah.
session today?
Yes.
That'll probably take like about 40 minutes or so.
Okay.
Okay.
Everybody wants to know when I can sing again.
I bet.
Okay, guys. I'm gonna look again. I wanna see.
Hold this on your neck for me. That's that little microphone.
Right there.
Yep.
Okay.
And then you look straight ahead. I'll record it and you can watch
Okay.
it. We'll watch it
Look
after.
straight at you, maybe.
Straight that way.
Straight this one.
Yep.
Okay.
Okay. Coming in through the nose, okay? Stick out your tongue. Good. Tongue back in. Chin up towards the ceiling a bit more. Good. And breathe. Say hee hee hee. And do a real gentle throat clear. Slow squeaking. Shoulder on the right end. Straight. Say. You did great. Good. Okay, so that big thing is gone.
Okay.
There's still a lot of swelling,
Yes.
as expected. Now, during surgery, I did find some scarring on the vocal cords. The scarring, you know, how long has it been present? I don't know.
Yeah.
But it was on both sides. Sometimes what I can do is I can inject a little steroid and the scar, because what it is there's 2 layers to the vocal cords.
Okay.
And what happens is that top layer can scar down. Okay, so that's what we mean by scar. Sometimes I can stick a needle in between, inject steroid, and the scar pops up. Yours didn't pop up. So it's pretty scarred.
Okay.
So there's a chance that that has been present a long time and you're used to that scar, or that that scar is kind of because of all the trauma that's been going on there with that mass down there. And there's not too much I can do to help fix vocal cord scar.
Okay.
So we'll have to see how your voice does.
So in terms of if I get my range back.
Yeah. With that scarring, a lot of times we lose that range or some of the control.
Yeah.
So we'll have to see.
Okay.
Okay. So this is what it looks like today.
Okay, guys, let me turn around. Okay.
Right, so
Okay.
this is the back of the tongue. That looks normal. This is the epiglottis, floppy thing that flops over the airway when you swallow.
Right.
And then those, your vocal cords right there.
Right.
Right, they look good. There's some swelling.
Okay.
And I'll show you the before so you can see what it looked like, what we took off.
Yeah, I remember that one.
Let's see. Nope, that was the
Was that big thing sticking out there?
Yeah, so that's the before and the after.
Right.
So
Big,
that thing's
big
gone,
difference.
yeah. And so there's scarring along where this was, and there's a little scarring on the other side where it had been hitting.
Yeah.
But you know, when we look at the operating room pictures, that was kind of the before and the after. This is, it looks really big and swollen because I injected steroid into both sides.
Okay.
Okay.
But you have seen these before, maybe not as extensive as mine.
The scar. Oh, these?
Yeah.
I've seen
No,
all.
I mean, have you ever heard of scarring before?
Yeah. There's definitely different degrees of it. Some are
Yeah.
really mild. There's quite a bit of scar.
Okay.
Yeah. Yours is on the more severe side, I would say.
Have you ever had people that kind of, any singers that kind of be able to work with it, no?
Yes, but you had to modify, you know, knowing what you can do and can't do, and instead of pushing and trying to do what you did, trying to kind of change your style and your range based on what you can get to and what's comfortable. But there's still a lot of swelling down here.
Right.
So, you know, for another couple weeks, you know, let's just take it easy. We'll do some speech therapy, kind of slowly return to the voicing, slowly return to the singing, and then we'll kind of see what we have.
Okay.
So what I want to do is I want to see you, probably already have an appointment in about 3 months. Oh, we don't. So what I want to do is I want to see you in about 3 months.
Okay.
And I want to see how therapy went. I want to do another camera exam.
Okay.
I can't really see the scar today because there's so much swelling.
Yeah.
So I gotta wait for that to settle down.
Okay, guys.
Okay.
You're going to therapy.
So if you
Okay, guys. So we're going to bring up another video now. Okay. Side where it was.
So that makes sense because that's probably where it's been working and it's healing and all that stuff. So we understand it. We're just going to watch it. That should get better with time.
Okay.
And then let me see what today looked like. Just going to move it along. We don't need to look at the whole thing. Oops, come back. Oh, that looks good. Okay. Let me back it up a little bit. So that's the healing site.
Right.
Okay, looks.
Your picture was better than the one I saw before.
Oh, okay.
Get a shot of that one.
So, you know, the big bump is off, but this is the wound that's healing, right? That's the wound there. And this is what we want to be mindful of for at least a few more weeks.
Okay.
The thing about surgeries to the voice box, well, the surgeries to the vocal cords, is that we don't put stitches in this.
Yeah, right.
So what we're doing is just laying the skin kind of back down. Now, if you use your voice a lot, you might rough up that healing spot. It's like
taking a scab
or like smacking on a wound. So what we want to do is we want to be very gentle so that this has more of an opportunity to heal over the next few weeks.
Okay.
All right. So that's what you and I are going to work on. And then let me see if I move it along here. I just want to see how things are vibrating. This is harder to see because of the light source, but
I can see it though.
yeah. Let me back it up a little bit more. I had it too far. All right, here we go. Let's see. It's going to start in just a second. There we go. So this light source allows us to see movement. And what we see is that vocal fold that had the surgery is still a bit stiff. It's a little hard to see, and I look at the stuff all the time, so I know. But it's not vibrating quite the same way. The good side vibrates much better. This side is much more stiff, and that's partially because it's healing. It is moving though, which is good. So, we can see it move, but it's stiffer, okay? And that's just because it's swollen. And so we got to give that some time as well.
Okay.
But it's not completely immobile. It is moving, and that's good.
Okay. So we might over time, I might be able to work something back.
That's what we're working on, is how to optimize this, how to have this heal in the absolute best way so that it is the most squishy, mobile, pliable as possible for your voice. Okay. Questions so far?
I'm scheduled to go to work tomorrow.
What kind of work do you do?
I'm a dialysis technician.
Okay. So what I would say is keep your conversations to a minimum. Doesn't mean you can't say hi to people, but you may need to say up front to some people if they expect you to be more chatty. Just go, hey, I'm healing from a surgery. I can't talk a lot.
Sure.
I've even had some patients write out a little card because people will forget, and they don't mean to be forgetting. But then if you keep having to say that, you're using your voice.
That's true.
So you may just want to, or even, print out a little something and pin it to your shirt that just says, I'm on voice rest, I had voice surgery.
Okay.
And most people, once they know, they understand. But you may need to, remind people, hey, I'm not supposed to talk. But, the things you have to say are fine. Try to keep it to these kinds of easy conversations like you're doing with me right now.
Okay.
Try not to yell.
Okay.
If people are calling for you and expecting you to yell back, you just can't do it right now. It's just, you gotta kind of keep it easy. And I'm gonna give you a couple of exercises today to take with you.
Okay.
That can help it, just help things heal up well. That's what we're working on at this point. Okay. Something that helps the voice not contact so hard as it heals is if you are comfortable putting a little bit of a breathiness in your voice. So if you let it be a little more breathy, you hear what I'm doing with my voice.
Right.
That feeling.
Okay.
If you use a voice like this, the vocal cords, they vibrate, but they don't touch so hard.
Okay.
So if that's comfortable for you to try and use, you can use this voice.
Sure. Yeah, easy.
Yeah.
Easy voice.
Hello.
Hello.
How are you? There's air in it. Yeah, I'm not.
How are you?
Yeah, I'm not just trying to be quiet.
Yeah.
There's air in it.
Okay.
It's like you're signed to talk. Hello, how are you?
Yes.
Yeah.
Okay.
That strategy can be helpful for some people.
Okay.
But still, overall, we want you being conservative.
Okay.
Yeah.
Now, I sing in the choir, and I'm also a praise and worship leader, and I'm also a Bible teacher.
Okay. I would suggest, if possible, can you offload those to somebody temporarily for at least a few weeks?
Okay.
I really would. I would really look for places that you can really back off in the short term.
Okay.
If you can. I'm not talking forever,
Yeah, right.
But we got to give this at least another week or two to heal up a little bit better before we start putting more load on it.
Got it.
I realize we can't, in a perfect world, stop everything. We just can't. But if you can be conservative for a few more weeks, it's going to go a long way for the healing.
Okay. Okay.
So just do your best.
Okay, so
That's my point.
a few more weeks, I'm probably going to need to say, as far as the choir is concerned, we're not back for, I think, September or something. I
Okay,
don't know
so
when that
you'll
is.
be all right.
But the praise team, I can let them know they're doing good. They can
let them do their thing.
The Bible study.
Well, okay, something you can think about with Bible study is, are there ways that you can still be there and running things, but let other people do more of the talking for you?
Yes.
Then you'll be okay,
Yes.
right? You don't do readings, let other people do the readings.
Mm-hmm.
You are sort of facilitating a discussion, but you don't have to do a lot of it.
Okay.
If you can think that way, then you should be okay.
All right.
The thing would be is if you're the person doing 90% of the talking, that's really going to be hard.
That's going to be hard.
Yeah.
And as far as even if you're singing with the microphone, you still recommend no.
Well,
Like, are they none?
I would really lay off of that for as long as for at least a few more weeks.
All right.
I really would.
Just want to be sure.
Because we're trying to keep you to the minimum amount of wear and tear on those contact points, and unfortunately singing just drives that up by the nature of singing. And it's not a question of who has good technique and bad technique. It's just singing in general. We put energy into it, right? Projection, all of those things. Even with a microphone, you are still contacting a lot. So yeah, where you can. I mean, if there's some things you just can't not do right now, it's about how little can you do of those things, or how lightly can you do them, how gently. This isn't the time to push it and do the real high stuff, that kind of thing. But that's what we're aiming for now, okay? Just in the short term. The short term is going to get you better long-term results, as much as it stinks. I don't say these things lightly. I too am a person who has to use my voice a lot, right, for what I do, and I think about this. If somebody said, well, you'd have to just not talk, I'm like, ooh, that's hard. That's real hard.
It was a test. I did it for 10 days.
Yeah, and you did good. Yeah, and if you did it, then you did one of the best things you can do for you. So now we're just trying to get back into the groove, but we can't jump 100% into it. Okay, that's what we're looking for. Because what I would like is for you to feel that by the end of a day, you don't feel overworn out. You might feel more fatigue right now than you typically would in your voice, right? You might say, ooh, I feel like more tired by 4 o'clock than I would normally feel. That's normal because that place is still healing, right?
Right.
But what we don't want is to be pushing on that.
Okay.
We don't want you to wake up tomorrow and go, oh, I overdid it.
Yeah.
We want to stay within this feeling or better.
Okay.
That's what we're aiming for. Because that's a sign that you're not pushing those tissues too far.
Okay.
You're not irritating the wound. You're letting it heal. You're giving it time to heal. Okay? Questions about that right now?
No, I understand that fully.
Okay.
I've been doing a lot of. I play guitar as well, so I've been doing a lot of voiceless videos.
Yeah, that's great. That's great.
Been doing a lot of maybe remixing videos.
Yeah.
Things of that sort to give myself time to not have to.
Yeah. So, if you can stay in this voice a little more, then you see, what your voice is able to do for your videos and for your, for your work and all these other things. Now, let me I'm going to go grab something because I'm going to give you an exercise to take home today. Okay?
All right. So, guys, there you go. You hear what's happening, and we're going to work with her so I can get my voice back. Okay. And I know you guys are going to work with me on doing this. Thank you. Thank you so much. We're going to be doing some voice exercises very soon.
It's really simple, okay? But it can do a couple things for your voice, right? what we want to do is we want to make sound into the water. Easy, right? Now what we're looking for, we want everything to feel nice and easy. You don't want to feel like you're shoving, right? Yep, let me get yourself situated. The voice should feel like it's working easy. Feel like the vibrations are up at your lips, you know, on the straw. Easy enough, right? Now let's try moving the pitch. Do like a little, just try something gentle. So something's trying to squeeze there. Notice the bubbles aren't quite working, right? So let's try it this way. Let's think instead of a hum, think like you're going ooh into the straw. Yeah. Yeah. I think more of the air wants to come out your nose than out your straw. So try taking the straw out of the water for a second. Yeah. You feel how the air is going through your mouth, through the straw? There you go. Yeah. Or you can think you're trying to be windy. That kind of feeling? Yeah. Right? It's okay. There you go. And now that you got that feeling, see if you can start it in the water. Better. You see how your bubbles are more stable, right? They're more constant, right? So now instead of starting from the top, let's start lower. It's still trying to stop it, but that was better. But what this, I know this is so weird, right? But
I love it.
But what this is showing us is your body letting you make this sound on a lot of easy air, or is it trying to control it from here? What we want are more steady bubbles, lots of air. Wasted. It's okay if it's not, if it feels like overdone. It's okay. Better. Yeah. And you can take breaths wherever you need to. It's not about how long you do this right now. It's about it feeling easy. There you go. Yeah. Now, as you do this, sometimes you might notice your voice might crack or cut out as you do this. Don't worry about that yet. It absolutely might do that because what this does is it helps you make sound without as much pressure here. Okay? It's like good vibrations to help things relax and heal. Right? That's why we want to do this. But also for you, it's showing where things still want to squeeze from your throat and not just vibrate and let the air work easy, right?
Yes.
So this is an exercise you can do for short chunks of time. 2 to 3 minutes. You don't have to do it for very long, but you can pick this up multiple times a day.
Okay.
It's going to help you get that balance back, but also it's going to help the vocal folds heal better. We have evidence that this kind of vibration from this actually helps heal the tissues.
Awesome.
Okay? So
I can do this at work.
Yes, exactly. And just, every, hour or so, 2 hours, you can just go off to a corner for a couple of minutes. You can even do a song. Like, I always do happy birthday when I'm showing this, but what we want is just that air. You got it. Yeah. And for you, always try for more air. It's okay if it sounds like this. It's totally fine. More air, the better, okay? Questions on this guy?
No, like it. Love it.
It's a really good starter exercise for you, okay?
Love it.
If your voice is even feeling a little tired, try it. See if it shakes off a little of that fatigue, too.
Okay.
It can be used in some different ways. I'll give you a little sheet to take home about this.
Yeah, what about in keeping the throat moist, what are the best lozenges? Anything?
So the absolute best thing you can do is just maintain good hydration.
Okay.
Your best thing is drinking enough water on a regular basis.
Just staying with the water.
But if you're feeling particularly dry, what we say is to stay away from anything that's got menthol in it for right now, because that's not good for your issue.
Okay.
The drops that can be more soothing tend to be ones that will say they're a demulcent. It's a fancy word for things that coat.
Okay.
And usually they have pectin in them or xylitol. But good examples are like the Luden's cherries drops.
Okay.
They do it. I want to say Smith Brothers is another brand. You just have to look at the.
Right.
If you go to the like throat lozenges aisle, you need to look for things like that.
Okay. Luden's is good. I'm familiar with those.
Yeah, Luden's are pretty much everywhere. But you do got to read the label, because some types of Luden's may have the menthol. So you gotta flip it over and look at the label.
Yeah.
But honestly, sometimes even just like a butterscotch works pretty darn well. Because it's gonna just coat. It has you make saliva. It's got a little bit of that coating. I've had some people do well just sucking on a gummy bear.
Okay.
Because it's got that glycerin.
Yeah, it's stuck in the teeth.
Yeah.
But,
Well, don't chew it. Suck on it.
Yeah,
Let it dissolve and see how that feels too.
Yeah, because sometimes at work, I'm not always, if you're drinking, you have to run to the bathroom a lot.
Exactly. I know what you're saying. Yeah, we have the same problem here.
Yeah.
Yeah, so it's looking for those kinds of things.
Okay, because I did have menthol and I thought, no, this is not good.
Yeah, it's going to be more irritating to the tissues, so we don't want that for your situation. It's not a good one. Some people will look for, sometimes you'll see throat lozenges that have, as the active ingredient, slippery elm.
Oh, yeah, I've seen that.
They don't always taste great, but they work.
Okay.
Because they do that little bit of coating action. So you could try those if you see slippery elm lozenges. Just, again, check the
There's a
ingredients.
tea called throat coat, too.
And that's part of why it works. It's got that licorice and slippery elm. Those things are real. So whatever soothes is fine, as long as we're not doing something that's going to cause more irritation, which is menthol. And as long as you are doing your best to keep yourself hydrated. So, I understand the challenges of working in a medical environment and drinking on a regular basis. So for you, it may be just trying to sneak sips. Every once in a while, sneak a sip. Because if you are chug-a-lugging in between, you're just gonna pee it out. Your body can't process it fast enough, so you're just gonna be like, whoop, nope, and then you wasted it. So small sips go a long way. So you do your best. Good question, though. Good question. Any other questions?
Colds, coughing, sneezing.
So what I would say is,
I normally don't get those. I just like to know.
Yeah. So generally speaking, if you feel like something's bothering you here, try to not cough on it. Something you can do is what we call a huff cough. So basically you're doing a bit of a strong H sound.
Okay.
And then you swallow. And the reason is that puff of air going through somewhat tight vocal cords, but not all the way, might blow off whatever's bothering you.
Okay.
Really try to just say, yeah, if I have a tickle, do I really need to cough? Am I okay? Just because we don't want a lot of trauma on those vocal cords. If, God forbid, you get sick and you feel like you have a cough that you can't control, I would contact Dr. Ferraro about it. Because sometimes we give people extra cough suppressant while they're healing. You're getting past the danger zone, so I don't worry too much for you.
I just want to know.
But sneezing's a hard one though, because we can't control it. Just try to think of it as, I'm gonna just let the sneeze happen. Because I don't know if you know what I'm talking about.
I don't suppress it.
Yeah, we don't want to suppress it, but also, do you know, like, I see this more in guys. Do you know how they almost make sneezing like a performance? Where they lean into it. Do you know what I mean? Like some people, they sneeze and they go, right? And then there's those guys that are like, right? Try to not be performative with your sneeze. Try to just be like, all right, it's gonna pass. I'm gonna do it, and I'm gonna be done. Because we can't control a sneeze. That's a real hard one. Some people say that they can turn their voice off when they sneeze, and they do something called a whisper sneeze.
Oh,
So
okay.
instead of going like a, they're like, right?
Okay.
I know. I find that a hard one. Some
Yeah.
people can choose, some people can't.
Yeah.
If you catch yourself and you feel like you can choose, that's great. But it's not suppressing it.
Yeah,
It's just turning off the voice.
Sure.
If you can't, don't worry about it.
Okay.
But good questions. And in general, just try to not yell, project. Just try to keep yourself in a nice, neutral
Yes.
place.
Yes.
Don't
Okay.
let people,
Yeah. Kind of a monotone.
Yep, just gentle. I call it the gentle voice. Just everything is gentle, everything is cool, just balanced. Even if it's not, you will be
Now,
talking that way.
if by chance, and this probably won't happen, but it could happen. In my work, if a patient is crashing, I do have to say no.
Then you do what you have to do.
Just,
You
I
will-
mean, it's
if
not
you
forever,
do-
but
Yes. So the reason we tell people don't do it, don't do it, don't do it,
Yeah.
is that little things are going to sneak through.
Right.
The occasional thing is not the problem.
Right.
The problem is if you are not being mindful at all
okay.
and you put a lot of wear.
Yeah,
So-
I'm gonna go to a concert or something.
Exactly. Yeah, you understand it. Yeah,
Exactly.
absolutely. So if something happens with a patient and you have to call for help, you call for help.
Yeah,
That's understandable, and that won't mess up everything.
got it.
But yes, if you were going to loud parties, loud restaurants, loud establishments,
Yeah.
right now that's a no. That
Yeah.
really shouldn't.
No.
Yeah, because we can control for those.
Yeah.
We can't control for everything at work. Believe me, I know. Things happen, right? They do.
Okay.
Good questions. You're trying to think through the problem. You're trying to,
Yeah.
think of how to structure yourself to be as conservative as possible. And that's
Yes.
the point. That's the point. As you're thinking, you're trying. And if you have other questions, you can always shoot them to us, okay? And just go, hey, is this okay? Or, and we'll give you some more advice.
No, I guess I'm just a little annoyed with myself because
Yeah,
for years I actually was a voice teacher.
yeah.
And then, what happened? My family passed away because I did it for years.
Yeah.
'Cause I was taking care of them.
Sure.
I went back into medicine, but out of teaching, and I went into just working into dialysis. So I got away from doing vocalises and all the things,
Okay.
and I'm still singing in the choir. So I knew I just got away from doing warm-ups, from doing all the things that you normally do before you sing. Nobody's fault but mine. I just kind of got away from that. And then you're singing full-fledged, and you're doing concerts, and you're doing all kinds of things. And I can remember, as I was telling
Dr.
Dr.
Ferrara.
Ferrara, there's one concert I can remember with Eastman, I think, somewhere. And I felt it strange, but it was amazing because I thought I felt it over here, but the thing was over there. I don't know. But anyway, and I started feeling, and then I would start after a while getting shut-offs.
Yes, something was off.
You go and I go to say a word and it shut off. Clear it, move. Wasn't sure. I thought it was goggling,
Sure.
doing all the things
Yeah,
you know
because
how
that's
to
a
do.
more likely, And, a lot of people wonder the why
Yeah.
with these.
Yeah,
It is, I would say, 99% of the time, it is just a unfortunate meeting of circumstances
Yeah.
that just push people a little past that boundary.
Yeah.
It's not that they're doing something bad or they're doing something wrong. It's just the circumstances at the time went just enough out of balance, I love thinking of singers as athletes. People really
Yeah.
need to think this way
It
because
is.
singers are using muscles.
it's a muscle.
They're using tuned muscles that have to have more strength, more agility, more skill, right? But because you are doing more with them, you ride a finer line between balance and overdoing it, right? Just like an athlete, just
Sure.
like a runner, just like a football player, just like a basketball player, right? And so you can get injured.
Yeah.
It happens.
It
And
does.
it's not because, we don't go, oh, well, that guy, you know, who got tackled and his knee got hurt, he doesn't know how to run. We don't say that, but we say it to singers. Oh, well, maybe they didn't know how to sing and that's why they got hurt. And it's just not fair. It's not fair. And, you know, we try to work with it. We don't know what's going on at first a lot of times, and you were doing your best and you were moving along the best you could. And then at some point you went, I need help.
Yeah.
Right?
For sure.
And that's okay. And that's why you're here.
I'm glad I got it.
And, you know, there was something there that needed to go. And we got it.
We got it.
And now we want to get everything working the best it possibly can under its new conditions. All right?
Okay.
So, you and I, and you know, maybe some more of the team here, depending on timing, we're gonna be meeting, you know, regularly for a little while.
Okay.
Kind of watching how you're healing.
Okay.
All right. I'm gonna talk to the team because my schedule is really nuts. Coming up for a few weeks, and then I go on a little bit of a vacation.
Okay.
And I just don't want that much time to pass before somebody's checking in with you. There are several other people here who also work with singers and understand your needs, okay? So I'm gonna talk to them, I'm gonna try to get a schedule together. Now, are there better days for you since you're going back to work? Do you have certain days regular that are off, or?
The one that is kind of stable for me definitely is Wednesday.
Wednesday, okay. I'll keep that in mind. We'll try to get you appointments on Wednesdays the best we can.
Okay.
If that's not gonna work, we'll talk about what we can figure out.
That'd be great. Wednesday afternoons.
Yeah, and a lot of voice therapy can be done remotely. You can do it online.
Okay.
And it works really well. So if for any reason that's a better situation for you, we can do that.
Okay.
Some people, it just gives them more freedom because they can kind of go off to a space for an hour, but it's harder to leave where they are, drive to the office. You know, it takes more time.
Yeah. Well, I never won, so no
Okay.
problem.
All right. Okay. We'll figure it out for you.
Yeah.
Any other questions for me today, ma'am?
No, not at the moment.
Okay. I'm gonna print you some instructions for your
Okay.
bubbles. The big straw is best, so if you want, you take that one home.
All right, I will.
Those are those bubble
This is
tea.
a big straw.
Yeah, that's a big one. Those are the straws they use for, I don't know if you've ever gotten bubble tea or
No.
boba tea. Have you seen the tea that's got those like black pearls in it?
No, I
Have you
haven't.
seen that? They have it at some like Asian restaurants.
Oh, okay.
But that's what they're for because they're these big chewy balls and you want to suck them up through your straw.
Oh,
So that's why those straws are so wide.
very interesting.
But for our purpose, it means you got to use more air. And that's what we want you to do. Use that air. Yeah, already that is so much better than where you started. Those bubbles are nice and steady and vigorous, and that's what we
Yes.
want.
I'm excited, guys. I'm excited.
Excellent. All right, let me just print this, and then we'll get you out of here for today. Did you check out for Dr. Ferraro?
Yes, I
Okay.
did.
All right, so you should be all set for right now. And like I said, we're gonna have to look at the schedule and get you set up, okay?
All right.
You're good. Yeah.
All right, guys. All right. Oops, I think we're back. Thank you so much for joining me. One of the things that I also wanted to mention, I forgot to ask the doctor, but gastric reflux also plays a part in that as well. And that is one of the things that I have dealt with over the years as well. So let me type that in. Even though I had medication with that.
It was the doctor's treatment. But there, gastric reflux plays a big part on your vocal cords as well. So guys, I want to say thank you. At first I was about to get down on myself when I started going through this process. And being human, I wanted to feel that I should have done better, should have known better. But I also know that, as the doctor said so well, even sometimes the best athletes get hurt, but they recuperate and they get up and start all over again. So guys, I know that there's some of you rooting for me, and I appreciate that. I'm going to do my best to do my part, to not do any yelling. I won't be singing for a while. So when you see my church services, and you won't see me on stage, it's because I'm recuperating. Why did I share this information with my audience? Because I know that I am not the only one. And I also know you need to know that we all go through things. And if I only show you the good side or my better side, you will never think that I'm dealing with issues like everyone else. Now, God has been really good to me. Many years, I have not had to deal with anything. My whole focus was on caring for others. But as I started doing YouTube in this ministry, the Lord wanted me to share with caregivers. We must focus and take care of ourselves. So now I'm practicing what I preach. So thank you. God bless you. And I pray that if you know anyone that is going through this process, that you will be kind enough to share this video with them. I know it's a bit graphic, but it gets the point across. I wouldn't have been able to explain it the way that it really happened. So thank you so much. God bless you all. And I'll see you in my next video.